Venous insufficiency is very common. In fact, it's the most common outpatient consultation I see in my clinic. People who've had leg swelling, varicose veins, or even spider veins, and they're looking to get them cosmetically treated for the appearance. There's absolutely nothing wrong with that. But venous insufficiency is actually a whole grading system, and the treatment plans are relatively straightforward. So when we talk about classification, number 1 would be spider veins. This is like the beginnings of venous insufficiency. You know, with some spider veins on your legs, it's like a window to what's going on inside your veins. So the valves may not be functioning properly, so they're loose and floppy, and there's blood that returns back to the into the legs instead of going one way from the legs to the heart. Number 2 is varicose veins. Number 3 is venous insufficiency-related edema or swelling of the legs. Number 4 is pigmentation changes. So a lot of people don't even recognize that the brown spots that you see on the legs, that's venous insufficiency. Number 5 is healed ulcers, most typically on the inside part of the leg in the lower ankle called the medial malleolus, and then also on the back of your legs. Number 6 is an active ulcer. So there's a whole spectrum of disease severity, and compression therapy is the mainstay. In fact, most insurances don't even approve medical-related vein treatments unless they've done at least 8 to 12 weeks of compression therapy, medical-grade compression therapy. And then having an active lifestyle, of course, weight loss. And if you've been diagnosed with a blood clot, you really need to keep your compression socks on because of something called post-thrombotic syndrome, which can predispose you to developing venous insufficiency. And then, of course, with anybody that has reflux or that leaky valve issue in the veins, we want to close those veins. And there's a couple of different treatment options out there. One of them is radiofrequency heat ablation. Secondly, there is glue, or it's also a way to close the vein by forming contact on the inside part of the vein. And the difference between radiofrequency heat ablation and then the glue is that it doesn't require tumescence, but the side effects could be somebody developing a reaction to the glue. And then number 3 is Varithena, which is a medication that's injected inside the vein, and it causes corrosing effect, and it shuts down the inside of the vein. And the intended result is for blood to circulate back up to the heart through healthier veins that have valves that close, instead of going through those leaky valve veins. Chronic venous insufficiency or leaky valves in your vein can be manifested in multiple different ways. So there's a whole classification system. Number 1 is spider veins, which are tiny little blood vessels that you begin to see in your legs. Number 2, varicose veins, which are a little bit more dilated. They're bigger. They may or may not hurt or bleed. Number 3 is swelling. Could be in the ankles, could be in the entire lower leg. You can also have aching, cramping pain, itching, burning, especially towards the end of the day. Number 4 is skin changes. So that's skin darkening, brown pigmentation on your skin. Those are all telltale signs that there's underlying venous insufficiency. Number 5 is a healed ulcer, usually on the inner part of the leg. And number 6 is an active ulcer. If you have any of those, it could be an indication of chronic venous insufficiency, and you definitely should get that checked out.